Well, the Tobermory Hyperbaric unit's been around for quite a while. We started operations here in 1976, and it was originally installed to be a backup in case of diving accidents. But it quickly became apparent that we needed to use it for the other conditions for which it's also indicated, both because it's an extremely effective therapy and because we needed to keep the crews on their toes, and that provided good opportunity for them to practice their skills. Basically, over that period of time, we've actually spent way more time treating medical conditions than we have diving conditions, by a ratio of something of the order of 99% to 1%. Most of the conditions we've treated have been the conventional conditions for which it's recognized therapy by OHIP and properly covered by insurance. That includes, for us, radiation damage, ischemic wounds, troublesome infections, and certain resistant cases of osteomyelitis, as well as acute vascular incidents such as arise from sudden sensory neural hearing loss or central retinal artery occlusion. Now, the reasons that the chamber has been valuable for that is because it's such an effective yet benign therapy. In terms of side effects, they're minimal, the principal one being boredom, because you're stuck for 90 minutes at a time breathing oxygen in a fairly confined space where you can't go very far. The other side effects, such as temporary myopia, dissipate within a few weeks of completion of treatment, and most people are able to accommodate to the equalization of their ears that's needed in order to avoid painful ears, or we can have a procedure done to introduce tubes through the eardrums that allows people to dive without having that problem.
Hyperbaric oxygen therapy is the process of treating people with pure oxygen while under pressure. The supply of oxygen allows tissues to heal more rapidly and combat infection more effectively. We usually try to run the chamber 2 times a day. Starting with the compression phase, we pump regular fresh peninsula air into the chamber until we reach 2.4 atmospheres of pressure. For 90 minutes, patients will breathe pure oxygen at a concentration roughly 12 times greater than they would be at normal pressure. This level of O2 is high enough to encourage a rapid healing process, but low enough to avoid oxygen toxicity. Every chamber is a little different. Here at the Tobermory Hyperbaric facility, we run our chamber manually, watching the depth, making corrective changes, and monitoring our patients' oxygen levels and their behavior with a live video monitors. Inside the chamber, our tenders support the patients, ensuring masks are snug and everyone is feeling healthy, happy, and secure.
In terms of its effectiveness, it's one of the only things that is of value in treating radiation damage. And the value of that to the system is enormous, as well as the difficult to assess value to the patients. One of the things that's frequently looked at with hyperbaric oxygen therapy is the cost, because it is an expensive process. But it's expensive only if you look at it in the short term. If, for example, we look at the treatment of hemorrhagic cystitis following radiation therapy, you don't see the collective effect of repeated hospitalizations, transfusions, surgeries that can be associated with this condition all at the one time. Taken individually, they're expensive enough, but collectively, they can easily exceed $50,000 to $70,000 a year. Hyperbaric therapy for this condition, on average, costs approximately $7,500. And the nice thing is, it's a durable solution. One of the problems with hyperbaric oxygen is that there is a good theoretical basis for its application to a number of other conditions. But because many of these conditions are fairly rare, it's difficult, first of all, to acquire the sort of numbers that are needed to provide the sort of scientific evidence that is being demanded these days as evidence of efficacy. The other problem with it is that, like any other medication, it has a dosage scale, and the variables in terms of its dosage are pressure, percentage of oxygen, and the time of the exposure. These are, result in three variables that you have to look at, combinations and permutations of in order to determine whether you've got A, an effective dose, and B, an optimal dose. In order to conduct any of it, you've got to have a chamber operation and the proper supports required in order to conduct effective insurance. The other problem is that in order to conduct this sort of research, you've got to have a chamber unit with proper staff and support facilities. And in many instances, because of these numbers, it's going to need to be a multi-center study to attract what's necessary.